Tuberculous peritonitis. Definition. It is the acute chronic inflammation of the membrane of the peritoneus, general or localized. It is especially common in patients with risk factors such as immunocompromised state, chronic renal disease, liver disease.
Peritonitis, itis means inflammation. So this is an inflammation of the peritoneum. And the peritoneum is the serosal membrane that lies in the abdominal cavity and is the one which contains the organs in the abdomen. The peritoneum has the parietal layer and the visceral layer. So peritonitis is an inflammation of the peritoneal lining of the abdominal cavity. It can be localized or generalized. And you can classify it as a primary peritonitis, secondary peritonitis, tertiary, chemical, and peritoneal abscess. And the causes of these peritonitis, the one that cause localized peritonitis include appendicitis, cholecystitis, diverticulitis, salpingitis. And for the generalized peritonitis is caused by a bacterial infection of the peritoneum cavity. And Streptococcus pneumoniae causes streptococcal peritonitis. Cirrhosis and ascites or renal failure in patients having continuous ambulatory peritoneal dialysis are at risk of developing peritonitis, which is generalized peritonitis. Polymicrobial and non-bacterial due to spillage of bile, blood with gastric contents.
Application in nursing. Control of vilosat. Exhaust evaluation of the site and symptoms that present. Provide adequate comfort. Oxygen therapy. Control intravenous fluids. Control the insensible loads, inputs and outputs.
Of the visceral parietal peritoneum and endothelial lining of the abdominal cavity or peritoneum can cause a peritonitis. Symptoms include rigid board-like abdomen, abdominal pain, distended abdomen, high fever, tachycardia, dehydration, low urine output, hiccups, compromised respiratory status, nausea, and vomiting. Peritonitis is caused by leakage of contents from abdominal organs into the abdominal cavity, usually as a result of inflammation, infection, ischemia, trauma, or tumor perforation. The most common bacteria is E. coli, Klebsiella, Proteus, and Pseudomonas. Other common causes are appendicitis, perforated ulcer, diverticulitis, and bowel perforation. Peritonitis may also be associated with abdominal surgical procedures and peritoneal dialysis. Sepsis is the major cause of death from peritonitis. Patient will go into shock from sepsis or hypovolemia. Intestinal obstructions from bowel adhesions may develop. When peritonitis is associated with peritoneal dialysis, the signs and symptoms, particularly cloudy dialysis fluid, may be enough to diagnose the condition. Secondary peritonitis may be when the infection may be a result of other medical conditions. Spontaneous peritonitis is when the infection comes from the fluid buildup in the abdominal cavity.
Pros and cons. Pros. Treatment largely support and is science at providing multidisciplinary surveillance at symptoms, manage of complications, include an adds genital dietetic regimen according to the clinical characteristics. Laparoscopy with biopsy is a valuable technique for the diagnosis of peritoneal tuberculosis. Cons. Rupture of the appendix or the allowed viscera, cirrhosis with discomfort, ascites, intestinal obstruction, massive hemorrhages.
Jillian Babcock, January 9, 2018, February 19, 2018. Peritonitis is a serious infection or inflammatory response that can either be confined to the peritoneum, abdomen, or widespread. What can cause peritonitis? A number of things can trigger peritonitis. Peritonitis is usually caused by infection from bacteria or fungi that enter through a leakage or a hole in the digestive system, such as the intestines or bowels. The condition is most likely to affect people with weakened immune systems due to having other health conditions, although it can also affect people with no previous history of risk factors. Can peritonitis be life-threatening? Yes, it can. This is why antibiotics are typically required during treatment, sometimes along with surgery. While antibiotics can be life-saving, natural remedies like a healthy diet, rest, and use of supplements can also help with prevention and supporting recovery by boosting overall health. What is peritonitis? Peritonitis is a condition characterized by inflammation of the peritoneum, which is the endothelial lining of the inner wall of the abdomen, the abdominal cavity. 1. The abdominal cavity is the space that holds the digestive organs. It is bordered by the abdominal wall, which is made of layers of skin, fat, muscle, and connective tissue. The peritoneum covers the inside of the abdominal cavity as well as most of the abdominal organs, such as the liver, stomach, and spleen. 2. As a serosal membrane, the peritoneum normally responds to stimuli, such as pathogens found inside the body, by causing an inflammatory response.
Should applied in Ecuador. Tuberculous peritonitis is a rare entity that accounts for 0.5% of extrapulmonary force. In recent years, this percentage may be modified a maneuver factor by the outbreak at human immunodeficit virus infection.
Tuberculosis, or TB, is one of the oldest and most common infectious diseases. About 1/3 of the world population is believed to be infected with TB. Fortunately, only about 5% of these infections progress to active disease. The other 95% of infected people are said to have a dormant or latent infection. They do not develop any symptoms and do not transmit the disease. Tuberculosis is caused by a rod-shaped bacterium, or a bacillus, called Mycobacterium tuberculosis. An infection is initiated following inhalation of mycobacteria present in aerosol droplets, discharged into the atmosphere by a person with an active infection. The transmission process is very efficient, as these droplets can persist in the atmosphere for several hours and the infectious dose is very low. Less than 10 bacilli are needed to start the infection. Once in the lung, the bacteria meet with the body's first-line defense, the macrophages. The bacteria are ingested by the macrophages, but manage to survive inside. Internalization of the bacilli triggers an inflammatory response that brings other defensive cells to the area. Together, these cells form a mass of tissue, called a granuloma, characteristic of the disease. In its early stage, the granuloma has a core of infected macrophages enclosed by other cells of the immune system. As cellular immunity develops, macrophages loaded with bacteria are killed, resulting in the formation of the caseous center of the granuloma. The bacteria become dormant, but may remain alive for decades. This enclosed infection is referred to as latent tuberculosis and may persist throughout a person's life without causing any symptoms. The strength of the body's immune response determines whether an infection is arrested here or progresses to the next stage. In healthy people, the infection may be stopped permanently at this point.
Conclusion. In conclusion, peritoneal tuberculosis depends on a different diagnosis of the picture of ascites and fever early treatment.
एक्यूट फॉर्म एंड क्रोनिक फॉर्म। एक्यूट फॉर्म के लिए हम लोग ट्यूबरकुलस पेरिटोनाइटिस वर्ड भी यूज़ करते हैं। क्रोनिक फॉर्म में हमें एसाइटिक टाइप, फाइब्रस टाइप, इंसिस्टेड टाइप एंड पुरुलेंट टाइप ऑफ लीजन देखने के लिए मिलता है। एक्यूट पेरिटोनियल ट्यूबरकुलोसिस पे बात करने से पहले ये बहुत इंपॉर्टेंट इमेज है, ये क्वेश्चन भी पूछा गया था। Abdominal cocoon syndrome. It is dense adhesion in peritoneum and omentum with content inside as small bowel causing intestinal obstruction. Talking about acute tuberculous peritonitis, it present as acute abdomen and are often subjected to emergency surgery. On opening abdomen, straw-colored fluid may be present and tubercle may be found to be scattered on the peritoneum and greater omentum. बात करते हैं क्रोनिक ट्यूबरकुलर पेरिटोनाइटिस की। इसमें जो हमारा एसाइटिक फॉर्म होता है, यहाँ पे हमें इंसिडेंस ऑनसेट देखने के लिए मिलता है। Here abdominal pain is usually absent. Rolled up greater omentum infiltrated with tubercles may be felt as transverse mass. Talking about incested or loculated form, there is a localized swelling and diagnosis is usually retrospective. Talking about fibrous form, widespread adhesion may cause coil of intestine to be matted together and distended, which act as blind loop leading to steatorrhea, malabsorption syndrome एंड एब्डोमिनल पेन। इससे पहले मैंने जो क्लिनिकल फीचर्स पे बात किया और कॉम्प्लिकेशन पे बात किया, वो चाहे गैस्ट्रोइंटेस्टिनल ट्यूबरकुलोसिस रहे या पेरिटोनियल ट्यूबरकुलोसिस रहे या कोई भी एब्डोमिनल ट्यूबरकुलोसिस रहे, वो सेम रहेगा। देखिए